Welcome to the Laughter Clinic podcast with comedian and suicidologist Mark McConville, bringing you practical, evidence-based self-care strategies, the latest research in mental health, along with conversations that inspire, educate, and entertain. This is the Laughter Clinic podcast with your host, Mark McConville.
Hi, my friends. Mark McConville here, and welcome to this episode of the Laughter Clinic podcast. As always, very appreciative of your time in tuning in, and I hope you are well wherever it is that you are listening in the world. If you haven't already done so, hit the subscribe button and all of that jazz. And yes, today we're going to have a chat about social prescribing and where it is, what it is, and where it's heading globally, and what's happening, or should I say more accurately, what is not happening right here in Australia. And I want to talk about the Australian federal budget because, these two interlink. So we've actually got a lot to unpack in this episode. So let's get straight into it, right? So in 2025, the Australian government commissioned a feasibility study into social prescribing in Australia. You heard me mention this a couple of episodes ago, right? Now, the result is a 108-page document that maps out a blueprint for a system that could genuinely transform how we approach health and well-being in our country, here in Australia. And now this is the frustrating bit. 6 months later, in May 2026, last week, the federal government budget came out, the 2026-27 federal government, and the feasibility study didn't get a mention. Not one word. I have not been able to find any mention of social prescribing, the National Social Prescribing Feasibility Study, link workers, or a National Centre for Social Prescribing. I haven't been able to find any of it referenced in the 2026-2027 budget, federal budget papers. I haven't been able to find it in the budget overview, the Treasurer's budget speech, the Health Minister's main budget release. It's just not there, right? So this is what I want to unpack that silence today. And I also want to talk about the response from the Royal Australian College of General Practitioners, because I think their response also to the federal budget tells us a lot about where we are as a system. So, grab a coffee, my friends, unless, of course, you're driving. And if you're listening while you're driving, watch the road, get comfortable. So we're going to dive in. So let's talk about, firstly, why it is that I'm invested in this topic. So as many of you would probably know, I've been advocating for over 10 years for there to be a link between the comedy industry and mental health. And I've got my Churchill Fellowship application in at the moment, which would, if I am lucky enough to be awarded a fellowship, it would involve me travelling overseas to America and Canada and the UK to look at how comedians and comedy are being used as legitimate non-clinical adjunct mental health treatment. So this stuff's happening around the world. And so then when I came across the fact that Australia had commissioned a national feasibility study into social prescribing last year, I was excited. I thought this is a moment, this is a moment that could really change the health system in our country in a big way. And the government has been given all of the evidence from the feasibility study, which offers clear suggestions and pathways for implementation. And then the budget comes out, and there's not a mention of social prescribing or the feasibility study. So it's what does that tell us? So I want to first unpack the feasibility study for you, because it's excellent work and it deserves a mention. It's actually called Social Prescribing in the Australian Context, a National Feasibility Study Report, right? And so let's start with the basics. Social prescribing in the practice of healthcare is the practice of healthcare professionals, most commonly GPs, referring patients not just to clinical services but to community-based non-clinical supports, things like arts programs, nature walks, volunteer opportunities, cooking groups, sports clubs, creative writing, community engagement with community gardening, all that sort of stuff. And yes, comedy, right? Comedy, music classes, art classes, that sort of stuff, and comedy as well. Now, the key feature in social prescribing in the process is someone called a link worker. So when a GP or health professional recognises that a patient is struggling, not just physically or mentally, but socially, that they're isolated, they're feeling lonely, they're lacking purpose, they're struggling in some way, they don't just write another prescription, right? This is the beauty about it. They refer that person to a link worker, and the link worker sits down with that individual and has a proper conversation, not a 10-minute clinical assessment, a real conversation about what matters to that individual, what is going on in your life, what do you need that the health system isn't giving you? And then they connect that person with community resources that can actually meet those needs. It is a bridge between the health sector and the community sector, and it is transforming healthcare in countries around the world. So the feasibility study in November 2025, 6 months ago, the Australian government's Department of Health and Aged Care, they commissioned this study, right? The social prescribing in the Australian context. This was a study that was led by the Australian Health Policy Collaboration at Victoria University, headed up by Professor Rosemary Calder, and it is a remarkable piece of work. Over 12 months, the team conducted a rapid evidence review of global social prescribing literature. They ran an extensive program of consultations with Australian and international experts and developed a detailed set of recommendations of how Australia could implement social prescribing systematically. So let me tell you what they found. First, the scale of the problem it's designed to address. The report makes clear that social and non-clinical factors, things like loneliness, social isolation, poverty, lack of purpose, housing stress, account for between 30 and 55% of health outcomes, not disease, not genetics, social factors. And in Australia right now, 1 in 3 adults is affected by loneliness or social isolation, and for young people, it's even higher. So there are people walking into GP clinics and emergency departments not because they have a clinical diagnosis, but because they are disconnected, and the health system by design isn't built to address that. And so we refer them for more clinical care because that's what we have, right? Second, the evidence base is substantial, right? This isn't a fringe idea, social prescribing. As at the time of the study, more than 25 countries around the world are implementing social prescribing. The UK's National Academy for Social Prescribing has produced a wealth of data. So the UK are world leaders in this. They really are. In the United Kingdom, data from multiple localities shows that social prescribing leads to a 42 to 50% reduction in GP visits, with a 23 to 66% reduction in emergency department presentations for individuals who are engaged with a social prescribing service. Let me say that again, right? I didn't misread that. Let me say that again. Between 42 and 50% fewer GP visits, and between 23 and 66% fewer emergency department presentations. In a country where GP access is in a crisis, where emergency departments are overwhelmed, where hospital ramping is a daily news story, these numbers for Australia could be extraordinary. And the economic case is clear. You know, we talk about return on investment, and it's all about money, right? And the feasibility study commissioned its own social return on investment analysis, right? So the social return on investment, looking at a New South Wales program, the result was $5.80 return for every dollar invested. A separate iCare New South Wales analysis of the same program found a $3.80 per dollar return on investment, right? The variation is in methodology, but both figures point to the same conclusion. This pays off, right? It really does. Social prescribing pays off. In comparison, the UK estimates for social return on investments are £3.42 for every pound invested. In Canada, they estimate $4.43 for every Canadian dollar invested. Basically, every country that has done the analysis arrives at the same conclusion. Social prescribing is not just good for people, it is economically sound policy. So the feasibility study talks about 4 implementation options, right? It doesn't just say, this is a good idea. It actually maps out how to do it. It identifies 4 implementation options, right? So we're talking here about a national social prescribing framework, a National Centre for Social Prescribing, Primary Health Network co-commissioning, national infrastructure investment. Right, the report is clear that the National Centre for Social Prescribing is an essential requirement. It's the cornerstone. It really is. Having a National Centre for Social Prescribing is a cornerstone. And look, I will put a link in the show notes to the feasibility study so you can have a look through it yourself if you desire to do that. And, it makes a pretty interesting reading. Now, the important thing here is also to acknowledge that the report acknowledges that Australia's Aboriginal community-controlled health services have actually been doing integrated health and social care since 1971, right? This is not a new concept for First Nations communities. It's a new concept for the Western health system, and the report calls for governments to learn from, right, and support the Aboriginal community-controlled health services model, not replace it, support it. So there is serious, rigorous, evidence-based this is, right, a serious, rigorous, evidence-based policy document, this feasibility study. It is saying to the Australian federal government, here is the problem, here is the evidence, here is exactly how to fix it, here is the cost-benefit analysis. Okay, so let's do something about it. And now let's talk about the global picture, right? And this is where Australia is unfortunately falling behind. So if we zoom out to see what's happening around the world in relation to social prescribing, because I think that we need to put it in context, which is quite important here. The United Kingdom, as I said, is the most advanced country in terms of national implementation for social prescribing. Their National Health Services has embedded link workers into GP practices across England. National Academy for Social Prescribing coordinates research, standards, advocacy at a national level, right? Social prescribing is now a mainstream part of how primary healthcare is delivered in the UK. It's not a pilot program, it's not a trial, a standard part of the system. Scotland, in fact, has its own community link worker program specifically embedded in deprived communities. Wales has a national program. Northern Ireland is developing its own approach. This is not experimental anymore. This is established medicine that is doing this. Canada is developing rapidly in this field. The Canadian Institute for Social Prescribing, led by Dr. Kate Mulligan, who was actually on the expert advisory group for the Australian feasibility study. Kate has been driving national standards and research. Their social return on investment data that shows the $4.43 per dollar that I mentioned before is being used to make economic case to government, and it's working. And then we have the World Health Organization and their response to this social prescribing outlook to healthcare. So in March 2026, the World Health Organization Collaborating Centre for Social Prescribing Policy and Development was launched in partnership with the UK's National Academy of Social Prescribing. The World Health Organization has now recognised social prescribing as a legitimate global health priority. A legitimate global health priority, my friends. When the World Health Organization gets involved, that's not a trend, right? This is a paradigm shift. And here in Australia, we have a world-class feasibility study published, within the last 6 months, published in November 2025, commissioned by our own government, saying that we can do this. Here is how. Here is the evidence. The evidence is overwhelming. And then the federal budget came out last week, and the silence speaks volumes. So on Tuesday, 12th of May 2026, the Albanese government handed down the 2026-2027 federal budget. Now, to be fair, there was some genuine good news for health in the budget, right? $3.5 billion investment to strengthen Medicare, which is the cornerstone of healthcare in Australia. $25 billion commitment to public hospitals, $277 million extension for mental health programs. These are not nothing, right? They represent real investment in a health system under serious strain. Unfortunately, in the suicide prevention sector, they haven't committed funding to the National Suicide Prevention Strategy, unfortunately, but that's a whole other case. But what wasn't in the papers, right, in the media release, the budget papers, the documents, when I did a search for all of this, I was just looking for two words: social prescribing. And as I said, I have not been able to find any mention of social prescribing. I did a search for the National Feasibility Study, for link workers, for the National Centre for Social Prescribing. I searched for all of it and I couldn't find it. It's just not there. It's not in the Health Minister's media release. It's not in any of the primary care measures. It's not mentioned in any of the mental health funding. It's not in the preventative health initiatives, which is where you would really be expecting to see it. It's just not there. Zero mentions anywhere, right? 6 months after after they received a feasibility study calling for the establishment of a National Centre for Social Prescribing. 6 months after receiving a document that said for every dollar you invest in Australia, you could get $5.80 back, right? 6 months after researchers, clinicians, community organisations and international experts told your own commissioned team, this is ready, this is needed, this is being done around the world, we know how to do it, right? The budget comes out, not a cent, not a mention, not even a commitment to further consultation into social prescribing, which really is quite disheartening. I mean, seriously. And what would it have taken, really? You know, what would it have taken? We need a champion for the cause within government. Basically, that's where you got to start. You need someone within the government to be a champion for the cause. So let me be specific about what was being asked for in the feasibility study, right? So because we know that not everything gets funded in budget cycles, but the report identifies stepping stone options to start to implement social prescribing in Australia. And like the establishment of a National Centre for Social Prescribing could be done as a standalone first step, like a coordinating hub, a knowledge centre, a platform for which everything else is built, you know, the formation of a national social prescribing framework. And what would that cost, really? And the return on investment, social analysis demonstrates that, you know, you can get 5 times your money back on what you spend on social prescribing. So the silence on social prescribing in this budget, it's all about priorities, right? It's a priority decision, and it tells us something uncomfortable about where social and preventative health sits in the hierarchy of political will, you know, because basically there's so much talk out of the federal government in relation to housing, and I get it. I totally get it. But here it just seems inconceivable that the government 6 months ago or not even 6 months ago, has been given a document to support this, and they don't even make mention of it. And then we have, this is an interesting thing as well. We have the Royal Australian College of General Practitioners, right? Now this is something that I found genuinely confusing, and frankly, you know, I don't know what to make of this. I really don't. So when I was doing my research for this episode, so the Royal Australian College of General Practitioners, right, on the 26th of March this year, which was Social Prescribing Day, right, 6 weeks before the budget was handed down, the Royal Australian College of General Practitioners published a statement for Social Prescribing Day, and it was pretty strong, right? It was really strong in actual fact. Now, I know that this is only 6 weeks before the budget's handed down and so many of the budget decisions have probably already been made, right? I get that. And nobody's making any last-minute changes to the budget in relation to this. But it's the conflicting views of the Royal Australian College of General Practitioners that's confusing, right? So here's the thing, or the contradictory views, right? So 26th of March this year, Social Prescribing Day, Royal Australian College of General Practitioners calls for community connection to be treated as essential health care. Dr. Kuljit Singh, Chair of the Royal Australian College for General Practitioners, so he's the chair of the Special Interest Group for Social Prescribing, has said in the document, activities involving movement, nature, arts, culture, education and heritage are not extras, they are evidence-based interventions, Dr. Singh said. Social prescribing is not a nice to have, it is a must-have if we are to curb the rise of chronic physical, mental and social illness affecting Australians and our communities. On Social Prescribing Day, the Royal Australian College of General Practitioners is calling on governments, health system leaders and digital health providers to invest in the structures that allow social prescribing to be embedded in routine care. Recognising community connection as healthcare is a critical step toward a healthier, more connected and more resilient Australia, Dr. Singh said. It's pretty clear. That is clear. It is unambiguous. This is a public statement of position on social prescribing from Australia's peak body for general practitioners. They say it clearly. Social prescribing is a must-have, not a nice-to-have, right? A must-have. And so now just in relation to the Royal Australian College of General Practitioners, I should note that they have established a special, as I said, they've established a special interest group on social prescribing. They established this back in 2022. They've been actively engaged with this space. They co-hosted a roundtable with consumer health forums. This is an organisation that has, at the clinical level, generally embraced the evidence base for social prescribing. So you would think that when the federal budget came out and the budget completely ignored the social prescribing feasibility study, and you would think that the Royal Australian College of General Practitioners' response would be all over it, right? Nope. On the 13th of May 2026, the day after the budget was handed down, the Royal Australian College of General Practitioners published their budget overview for health, a 9-page document basically in response to the Australian federal budget. And social prescribing didn't get a mention. Didn't get a mention. Again, not once did it get a mention in a 9-page document from an organisation that 6 weeks earlier had publicly declared social prescribing to be a must-have. There is not a single mention of it in their budget response. The document covers Medicare, urgent care clinics in details, general practice workforce, mental health funding, aged care, bulk billing, compliance, fraud, these are things that are covered, but the complete absence of social prescribing in the Royal Australian College of General Practitioners budget response in the week after the budget failed to fund any of it is a missed opportunity of significant proportions. Because here's the thing, advocacy, right, works when it is consistent and it is sustained. It needs to be sustained. When you say this is a must-have in March, and then the government budget in May totally ignores it entirely, and then your budget response in May doesn't mention that at all, doesn't mention the fact that the government hasn't even mentioned social prescribing in the budget papers. You've just told the government that, we'll say all these nice things on Social Prescribing Day, but we don't actually need you to fund it. and the government hears that sort of stuff, right? And I'm not saying the College of General Practitioners doesn't care about social prescribing, because clearly at the level of their social prescribing interest group, they do. There are clinicians that care about this and champion it. And there is genuine commitment, but institutional advocacy requires institutional follow-through. And this budget cycle, the follow-through didn't happen. And this is this gap, because social prescribing will not be funded in Australia through goodwill alone. It will be funded when the most powerful medical organisations in our country make it a non-negotiable budget priority. And that hasn't happened yet, right? They can say these things, but it hasn't happened yet. Advocacy they need to step it up. They really need to step it up. Now, there is one organisation that has been consistently, explicitly calling on the federal government of Australia to act on social prescribing, and that is ASPIRE, the Australian Social Prescribing Institute of Research and Education. Don't we love our acronyms, man? Everyone, we love our acronyms. And ASPIRE has put forward various recommendations to the federal government. They're calling for a dedicated national prescribing strategy, sustained long-term funding for social prescribing, national standards and accreditation for link workers, very important there, those link workers again. So that way this workforce has a professional home and a clear career pathway. Minimum data sets and evaluation frameworks, community resource mapping. These are not radical asks. They are the infrastructure of a functioning system, and every single one of them was also recommended by the 2025 feasibility study. The path is clear, the evidence is clear, and the asks are clear. So what is happening in Australia when it comes to social prescribing? Because it's not all despair, and I want you to think that, right? Because things are happening, but they're happening in silos. They're happening in various, there's no national coordination at this stage. They're happening in little bits and pieces around the country in primary health network levels and this sort of stuff. So, I'll give you a couple of examples, right? So in April this year, just last month, the Ramsay Hospital Research Foundation, this is the Paul Ramsay Research Foundation, awarded a grant of over $750,000 to a social prescribing research project led by Northern Sydney Local Health District. This is a 3-year study focusing on older adults, a population that is particularly affected by social isolation and loneliness, right? It will look into how social prescribing can improve outcomes for older Australians and reduce pressure on acute care services. And that's the type of stuff. That is exactly the kind of rigorous longitudinal research that builds the evidence base. The Victorian Social Prescribing Collaborative continues to do important work at the state level. The Australian Disease Management Association is hosting a national social prescribing network that brings together practitioners, researchers, consumers and policy makers. All of this stuff is happening at a primary health network level, community health organisation, neighbourhood houses. There's no national coordination when it comes to social prescribing. But the conversation's growing, right, which is good. The feasibility study notes recent national reports, including the review of general practice incentives and the scope of practice review. Both explicitly call for multidisciplinary team-based care that includes non-clinical roles, right? That's the big thing, non-clinical roles. And I have to say, internationally, the momentum is, extraordinary. Like I said, what's happening with the stuff that's happening in the UK, world leaders, Canada, Scotland, Ireland, the World Health Organization saying that they want to make it a priority now. So we're not building from nothing in this country if we were to pick it up and run with it. We are not building from nothing. We're actually building from a lot. The foundation is there. The evidence from around the world is there. And this is one of the reasons why, if I get this Churchill Fellowship, going to the UK and finding a way to model what they're doing in relation to specifically on the comedy on prescription side of things for social prescribing and finding a way to bring that model back to Australia is so incredibly important, right? So But we need political will. We need political will, and it's just not there at the moment. So, yeah, that's a big thing. So my Churchill Fellowship application is in. Hopefully, I should know in the next few weeks if I zip through to the next stage of being interviewed, and then hopefully I'll be granted one, and I can go over. And like comedians in the US, you're doing suicide prevention training for the military. Incredible, right? Really cool. Guys in Canada teaching stand-up comedy to people with mental illness. Brilliant work. And the work that Lou Jackson and Crack Health are doing in the UK is world leading. It's incredibly impressive. So, social prescribing, it's just, I've said it before, I live in hope. I do live in hope that, I'm so hopeful, and it makes me feel good in the fact that right now there is somewhere in the world that you can get comedy on prescription, and it is happening in the UK, and it does give me hope, So anyway, back to the feasibility. So the feasibility study references something the Canadian Alliance for Social Connection and Health says, and I think this is really cool. This is a beautiful statement. They say that social prescribing, right, the Canadian Alliance for Social Connection and Health, they say that social prescribing should be seen as a catalyst for broader societal change. It brings the deficiencies of our social structures into sharp focus and emphasises the need for systemic change. The vision of social prescribing is not just to link individuals to existing services, but to contribute to a transformation that sees the rise of compassion and interconnected communities. Belongingness, so incredibly important. You hear me talk about it all the time. This is the vision, right? This is something that we can do. We can do in our country, right? And that's why when the budget came out, it was so frustrating to see that it didn't even get a mention, the feasibility study or social prescribing. And it just, we know what people need. We know what helps. We have the evidence and we have a blueprint. We just need to be loud about it, my friends. We need to be loud about it. So here's my call to action, my various call to action for those of you that may be listening. And this isn't only in Australia. This is, wherever it is that you're listening, what can you do? Because I generally feel as though there are things that we can do. There really are. Firstly, if you're a GP or a health professional, a primary health professional, start the conversation with your patients about their non-clinical needs, right? You don't need a national framework to ask someone what's going on in their life beyond their immediate health conditions, and advocate through your personal associations, through the Royal Australian College of General Practitioners, through the Social Prescribing Special Interest Group, for this to be embedded in budget priorities, right? We need voices at an upper echelon level to push this to government to make sure that it becomes a budget priority. And if you're a community organisation or you're running some kind of community social wellbeing program, you are already part of the social prescribing ecosystem, right? You are the destination. So reach out to your local primary health networks, get connected, make yourself known to the health professionals in your area. If you're a policymaker, a political advisor, or anyone with a line to government in some way, please read the feasibility study. I will put a link to the feasibility study in the show notes. Read the thing, the whole thing, and then ask yourself, what would it actually take to establish a national centre for social prescribing in Australia? What would it take to develop a social prescribing framework for our country? Right? Because the answer is not much in the big scheme of things, in the scale of the health budget. And the return on investment would be enormous, not only for the mental health of the people within the system of social prescribing, but community connectedness, the release of decreased burden on our health system, the return on investment is enormous. And so if you're a policymaker, anyone with a line to government, please have a read of this feasibility study and just see where that sits with you. And if you're a person who has felt that the health system doesn't really see you, doesn't see the loneliness, the disconnection, the weight that you may be feeling of life beyond your immediate health diagnosis, you're not alone and you're not imagining it, right? It's just that the system is not built at the moment to see those things. But trust me, there are people working every single day to change that. And like I said, when I came away from the National Suicide Prevention Conference, know that there are thousands of people that are working towards, finding a way to, so obviously that we reduce the amount of lives we lose to suicide, but also know that there are people that are pushing this barrier of social prescribing. And, my own personal barrier to push is comedy or prescription. I've got to, really the work that Lou Jackson and the guys at Crack Health are doing in the UK is so amazing. And I really do hope that I get a chance to go over there and meet them firsthand and really dive into the stuff that they're doing. So, and look, to the researchers and advocates and the people that are link workers and the community practitioners that are already doing this, and you're doing it, I know, with inadequate funding, in spite of all the barriers that you may be up against, kudos to you. I see you. I support the work that you're doing, and I really do hope that this episode helps in some way, So, yeah, the National Feasibility Study, published in November 2025, the 2026-27 budget didn't even get a mention. It's crazy. So the next budget is 12 months away. So, that gives us 12 months to be loud, 12 months to build the coalition, 12 months to hold our peak bodies to account, 12 months to turn evidence into political will, 12 months to find a way for the Royal Australian College of General Practitioners to say to the federal government of the day, it is not acceptable for you to not fund this, for you to not at least explore a future into social prescribing, build a National Centre for Social Prescribing and institute the framework, because the prescription is written and it's being written all around the world, and we just need our political leaders in our country to step up and look at what's happening around the world, and Australia can't be left behind. It really can't. So, my friends, that's it for me for today. I really wanted to get all that stuff off my chest, because it's something it's a conversation that I think is really important, that needs to be had. So thank you so much for listening, as always. I'm actually going to be off to Tasmania tomorrow for the Australian New Zealand Moral Injury Conference, first conference of its time. So learning all about moral injury, for a lot of it as post-traumatic growth and all that sort of stuff for, first responders and veterans and all that sort of cohort. But there's obviously a lot more people that are affected by moral injury than just those groups. So, that's going to be the rest of this week. Heading down there, Jody Allen from the Four Aussie Heroes, the lead facilitator, will be down there as well, joining me. And so we'll probably hopefully do a podcast wrap-up of the conference as well, so at the end of the week. So, my friends, like I said, it's a lot to unpack this episode, I know, but it's a conversation that needs to be had. So if you're interested, I will put, as I said, a link in the show notes for the feasibility study. I will also put a link in the show notes for the Royal Australian College of General Practitioners Social Prescribing Day statement, and also their budget response. And I'll also put a link in there to Aspire and their work as well. So, As always, my friends, thank you so much for tuning in. Really appreciate your time, no matter where it is in the world that you're listening. I hope that you're well, and please be kind to yourself and be kind to those around you. I'll talk to you next time. Cheers.
Thank you for listening. The information contained in this podcast is for educational and entertainment purposes. It is not intended, nor should it ever replace advice received from a physician or mental health professional. Want more info? Visit thelaughterclinic.com.au. If you enjoyed the episode, please share and subscribe. Thanks again for listening to the Laughter Clinic podcast with your host, Mark McConville.